mental health. It's hell. It can be hell. Um, especially, especially when it's not checked. It goes unchecked. And is exacerbated with substances. I just want to be clear here and say that I've never used any of my mental health diagnoses as an excuse ever. But here's what I do have. I have depression, I have anxiety. I've been diagnosed with manic depression in the past. I have PTSD, I had ADHD as a kid. And that's about the extent of it. But who I really feel bad for are people with worse mental health conditions like schizophrenia or bipolar. At one point, doctors thought I might be bipolar, but turns out I wasn't. Put me on lithium, and I wanted to unalive myself more than ever. So I went ahead and got off of that really quick. But I seem to be on the right, concoction now. To handle both my depression and anxiety, and to just help my PTSD as well, which mostly went away once I quit drinking alcohol, because that made it so much worse, which it will do. So yeah, I guess I'm pretty lucky, that I haven't done more damage to my life and to other people in their lives, because I don't know. I'm not the most sane person, but I'm definitely not crazy either. However, we all have our moments, but mine are few and far between now. And the one thing that helps the most is alcohol, or not alcohol, marijuana helps the most out of anything. It really just, it goes well with my anti-anxiety medication because weed helps my anxiety as well, and depression. So that's a win, a win-win, yeah. So there's a lot of ways you can deal with mental health. I've gone to a lot of counseling. I've been to the psych ward a few times when I was younger. And it takes years sometimes to get the right, medication sort of combination. At least for me, it took quite some time for me. My thing was every depression medication would make me gain too much weight, and that would make me even more depressed, of course, because nobody wants to be overweight. But yeah, now that I'm on like the right kind of combination here, I'm at a good healthy weight, not too skinny, not too fat, nothing like that. I just healthy, and all good here. But you see it every day though too now. There are a lot of people out there that will just pretend like they're mentally ill when they're really not. They say, "Oh, I have PTSD," when nothing traumatic's ever really happened to them. And all my stuff, I've been diagnosed by a doctor, officially. So I'm not just throwing shit out there. I legitimately have these diagnoses, and there's nothing I can do about it except take my medication every day and make sure I stay as sane as possible. Which isn't always easy, when you're living in an apartment complex, right? Sometimes the neighbors piss you off. You want to go over there and strangle them, but you can't. So, but I don't know. Going to the psych ward helped me a lot, in a lot of different ways. taught me a lot about how to like control my outbursts, things like that. Because I had anger issues when I was younger too, and everything else. I was a little bit antisocial, but at the same time aggressive, a little bit. So, I mean, it took forever to find the right combination for me, and I know there's like millions of people going through that same process right now, working with the doctors, trying to figure out what is the right combination of medicine for me to be taking. I've gone through so many different things. I don't want to name all the medications, but I've tried quite a few different ones. But yeah, I mean, I don't know where I would be without my mental health medication. I mean, a lot of people are like, oh well, I don't want to be on pills the rest of my life, or I don't want to be, I don't know, dependent on it, or whatever they think it is. But I really don't mind, because it evens me out and it makes me better. That makes my brain, kind of sort of, comprehend things more efficiently and react more, appropriately to situations, instead of overreacting and getting all, aggravated and aggressive, So, yeah, I mean, mental health, it's important, I've gone through countless counselors, too, until I found one that I liked, which, it really, got me, and it does take a while to find someone like that, you're not going to click with every counselor you meet, but if you hang in there, and if you keep trying, you'll find somebody that you somewhat get along with, It may not be like the, oh, I want to be your best friend thing, but, you're not supposed to be best friends with your therapist or counselor or anything. You're just supposed to be able to talk to them, so, and that's, I mean, that's the whole goal, and for years, I would go to counseling, but never say anything, never say what was bothering me, any of the abuse I suffered, anything like that. I would keep it all in and just be like, okay, well, tell me what to do. And they're like, well, I don't know what to do because you won't tell me anything about your life. I'm just like, okay. So eventually, slowly but surely, because I used to be really shy, a really shy person. I wouldn't talk to anybody. It's all different now, but back then, I had such bad social anxiety, which was also exacerbated by my alcohol use. Just to reiterate that, quitting drinking alcohol was the best thing I ever did. It actually made my meds work again, right? And yeah, I mean, I recommend if anybody has any kind of like thoughts about harming themselves or someone else, I mean, I don't know, it's crazy shit. Like the human brain is very fascinating. It can do some really crazy stuff to us, make us think crazy things in the heat of the moment. But as long as we don't act on those impulses, we get the help we need, counseling, therapy, we're all good. It's all good. You gotta find that right cocktail medication that's right for you. Anyways, that's about it. Peace.